Health is so important to people, and healthcare is an issue that we talk about quite often in our social settings and things like that. And there's so many people that struggle with personal insurance, and for that reason, we have great people who are here to help us. The volunteers in medicine with me today are Kim and Kim.
Mm-hmm.
So we have the Kim and Kim show. Welcome, ladies. Thanks
Thank
for
you.
being here with us.
Thank you for having us.
Tell me what Volunteers in Medicine is.
Volunteers in Medicine is a free medical clinic for people who do not have insurance and live in Martin County, and they meet income requirements, which right now is 200% of the federal poverty levels.
Okay. So, what types of medicine or what kind of specialties do you have at the clinic?
Well, we do pretty much everything at the clinic. The clinic is basically a primary care provider that coordinates all the medical care a person would need. So we can get any type of surgery, specialty, anything that a patient needs that's essential for their health care. We have hundreds of volunteers in the community that work with us, along with Martin Health. Cleveland Clinic Martin Health is also one of our really great partners that helps us with diagnostics and labs and surgeries and things like that. So we serve as kind of the central point, and then we help the patients get the rest of the care that they need.
That's awesome. So, if somebody comes in and they're having an issue, you have referrals that you can give to them, perhaps?
Yes.
Absolutely.
So we have certain specialists that come into the clinic regularly. For example, an ENT specialist, he's there once a month on a certain day. So we know we can schedule our patients there. But if it's a specialty that's not coming into the clinic, we'll reach out with a referral and they'll agree to see our patients, meaning that patient is being seen for free in that office.
That's
Yes.
awesome. So, what are some of the other programs that you offer?
Well, we
Kim's
have
great to talk about that.
my role there, I'm a social worker. I'm called a case manager. I do quite a lot of different things in the clinic, but we'll assess their other needs, their social needs. Do they have transportation? Can they afford their medications? Do they have housing? Do they have employment? Do they need employment? And we'll link them with other organizations in the community that might be able to help them with that. We also have a licensed clinical social worker who volunteers with us 3 days a week, seeing our patients for therapy. So we do try to address their mental health as well as their physical health.
That's fantastic. So, it's really not just, I need to go see the doctor because I'm not feeling well, I've got a cold, I've got a fever. There's so many other things that you can do to get that across and help people in a number of different aspects.
And we would really like to see patients who aren't already sick. So we estimate that there's somewhere between 7,000 and 9,000 people that are eligible for our services in Martin County, but aren't currently taking advantage of it. And so a lot of people feel that if they're not sick, they don't need to see a doctor.
Sure.
And so we offer all kinds of preventative care too. So we can get mammograms and we can get help with medications and even things like some over-the-counter medications that can be expensive, like allergy medications. We can help patients acquire those medications at either very, very little cost or free. We work with a lot of drug manufacturers to get medications for our patients.
That's so often. What is the base? How many patients do you think you see in a
We
week?
average right now about 1,000 a year, and it's very much of an ebb and flow, because the good news about Volunteers in Medicine Clinic is that once our patients get healthy and get well and recover their health, a lot of times they're able to get employment that offers insurance. So our patients kind of come and go. So as they need us, they come to us, and then as they kind of graduate from the program and get healthy and well and get better employment, then they move on. So
You don't see anybody that's insured.
we
Is
don't
that-
see any patients that are insured. There is a very tiny situation that happens if you've been in the hospital and are something they call Medicaid needy. It's a very special short-term type of insurance. So for those patients, but they're generally not insured.
Okay. So, if somebody is going to the clinic, they've been a patient, you can give them the referrals that they need to see somebody that takes their insurance once they might get it.
Well,
Is that
if they're
correct?
getting insurance, we usually direct them to the insurance company because that's so specific to the insurance that a person has, what doctors they're able to see. What's more common is our patients turning 65 and going on Medicare. And so we're aware of that. We do eligibility screening every year. So we see their birthday coming. We know, okay, in May, this person's going to be going on Medicare. So I work with them to make sure that they understand what that means. They understand that there are resources out there like the Aging and Disability Resource Center has something called the SHINE program where people will walk them through what the different types of Medicare are, how to enroll in different programs, and then they can choose a provider for primary care. We really don't want them to just leave and figure it out on their own. We
Sure.
do want to help them transition.
Are you a nonprofit? How do you get your funding?
Yes, we're a 501c3 nonprofit, and we're funded privately. So we get grants, we get private donations, we have events, and that's how we are funded. So we have a separate arm called the Friends of Volunteers in Medicine Clinic, whose primary goal is just to raise money for the clinic. And that group, that's what they do. That's their entire mission, is to raise money for the clinic.
Sure. And of course, volunteers are obviously needed. What type of people are you looking for volunteers all the time, or?
Yes, so we take both lay and medical volunteers, so any nurses and pretty much anybody in the medical field. So if you have experience in the medical field, we have a lot of retirees that really, your medicine is a calling. So a lot of people that are in medicine really want to continue practicing. So we have a lot of volunteers that come after they retire, and they can still see our patients. It's really a wonderful thing. So if they call the clinic, they can talk to our volunteer coordinator and find out all about it.
And what is the number if somebody wants to?
772-463-4128.
Okay. You have an event coming up.
We do, yes. FitFest. Vim FitFest. It is a wellness fair, and it's free for the community. So right now we have almost 40 vendors, and it's like a variety of vendors. It's 9 Rounds Fitness, it's providers, acupuncture, dermatologist. It's all variety of different businesses in the community that provide wellness services. And the day starts off with a color run. So I don't know if you're familiar with what a color run is.
No?
But it's a really fun, it's sort of part race and part celebration. And so what you do is you have a 5K, and at different spots in the 5K, they throw colored powder onto your shirt. And so when you finish the race, you look like you have like a tie-dye appearance on your shirt. It's really fun. And the colored powder is just cornstarch with food coloring. So it's very safe. And it's kind of, if you've ever heard of the Indian Holi Festival, it's similar to that. So it's a very celebratory feel. So
That sounds like it's
yeah,
gonna be
so
a
it
lot of
kicks
fun.
off with that on October 23rd at Flagler Park in downtown Stewart.
Fantastic. And if somebody, are there vendor spots available still?
Yes, there's still vendor and sponsor spots available, and if they visit vimfitfest.org, they can learn all about it.
Fantastic. What advice would you give to somebody that is not sure what direction to go in and they need some health care?
Just to give us a call. Everybody's got such a unique situation, and they may feel overwhelmed by whatever they're experiencing. And you go online and you see what services are available, but I really think that calling and talking to somebody, they can call and talk to me, and I can walk them through the process and let them know exactly what we do and how we can help them. And that way, they're enrolled and they're not so overwhelmed feeling like they're out there on their own.
Yeah.
And what are the hours of the clinic?
It's 8:30 to 4, so Monday through Friday.
All right. So if you are looking for some assistance in medicine, or if you're looking for some referrals, reach out to the folks at Volunteers in Medicine. They're going to take care of you and help you get what you need to make sure that you are the healthiest you can be. We'll be back.